Good morning. The committee will come to order. The clerk will call the roll. Oops. Nope. Sorry.
You have a quorum, Mr. Chairman.
All right. Good morning to everyone. Just a couple of items that we'll lay out to begin with. One, I know we have patrons here, and I'm very grateful for each one of you coming on the second day. This committee last year went through about 190 bills, and that's pretty close to what you guys have, Ryan, in court. So we really need to get a jump on things and move forward. The other is that this committee has worked collaboratively, I think, the last number of years, and that's great thanks to the Democrat leaders and the Democrat members and the Republican leaders for just working together. This committee has, as everyone knows, a number of items that have more controversy than some other committees, but we work our way through it, and we plan to do that again this year. You will note that this committee uses their timers, I think, aggressively and maybe effectively. And so on the right and on the left and in the middle and wherever you are, you're likely to have a timer. And also, if you go to a subcommittee and your bill is heard in subcommittee, unless there is something extraordinary, then we will not rehear the debate here. So please make your presentations there. So what we're going to do first this morning, and with some apologies to some of the patrons, to you guys, we're going to hear about 4 or 5 minutes from two of our secretary areas that have review in our area, and then we're going to begin with the bills. So, Secretary Kerry, if you don't mind, maybe we'll start with you. And we're delighted to have another Lynchburger in the room. And
Very good.
Great, good to have you here, sir.
Well, thank you so much, Mr. Chairman, and thank you to the members for having me for a few minutes. Before I get started, I want to make sure we introduce important members of our team. I want to introduce folks I know you already know, but Gina Berger is one of the deputy secretaries, and Marvin Figueroa is the other deputy secretary. Key folks to assist you as you have questions and need details to do your important work. So over the last year, Secretary, I've traveled to community service boards, local health districts, departments of social services, and the Commonwealth's mental health facilities, and I've met with advocacy groups and community leaders. And what I have seen are many dedicated team members serving Virginians in great need, sometimes with significant gaps in services. To address these gaps, Governor Northam has made continued improvement in our system among our highest priorities. And our vision is clear. Every Virginian, regardless of geographic location, income level, or insurance status, will have access to quality, affordable care. Our system will provide an integrated continuum of care that is patient and family-centered, cost-effective, and data-driven. The emphasis here is on integrated and on system, because fantastic assets in isolation will simply not get the job done. We are working to help break down silos between our HHR agencies and across secretariats and to foster better communication and collaboration, not just between people, but between systems. We have a number of strategies and initiatives to achieve this goal. First and foremost was and is Medicaid expansion, now Medicaid expansion implementation. Thanks to you, Governor Northam signed a budget last spring to expand health coverage to nearly 400,000 Virginians. Through a cross-secretariat collaboration between HHR, administration, public safety, we have developed procedures to ensure applications were processed efficiently so that people can get approval as soon as possible. As of January 1, over 200,000 Virginians are now covered for primary care visits, behavioral health services, substance use disorder treatment, and much more. In states that expanded Medicaid in past years, up to 50% of those newly covered have behavioral health or substance use disorders, so that coverage will make a great difference. And having a payer source has attracted new providers, as we have seen in the ARTS program. Virginia's Medicaid Addiction Recovery Treatment Services, or ARTS program, has provided life-saving addiction and recovery treatment to more than 24,000 Virginians who are served by Medicaid, and that was a 50% increase of those to get services in the year prior to the ARCH program. I'm also proud to say that thanks to your support, we now have 3 operational comprehensive harm reduction sites in Virginia which interrupt transmission of HIV and hepatitis and increase access to services such as testing, referral to treatment, and the disposal of used hypodermic needles, along with the provision of sterile ones. And on a personal note, one of the vivid experiences I had in my first year in this role was visiting in Wise County at their local health department, visiting with an individual who's in recovery, but his recovery has not yet weaned him off entirely of use of IV drugs. He underwent testing and was indeed hepatitis C positive. Getting into that program gave him, first, a diagnosis, second, access to services and to treatment, and his vision of success is that he is entirely off of any needle use within 6 to 12 months. And that's an individual that had been incarcerated. Now he's full-time employed, has custody of his children, and is looking to move up in his job. And those services were critically important and are critically important to his recovery. So thank you again for support of harm reduction programs in Virginia. Finally, in good news for Virginia children and working families, we have seen a significant increase in child care subsidy dollars. Virginia has utilized an additional $43 million from the Federal Child Care and Development Fund, a program that supports economic stability for many Virginia families and efforts to improve workforce development. As we start the new year, I want to assure you that our commitment to health and well-being of all Virginians is very strong and at the forefront of everything we do. The commitment means we must focus on some of the most difficult challenges Virginia faces. The Commonwealth Public Mental Health Hospitals run at 90 to 95% capacity every week. Far too many individuals in state mental health hospitals are ready for discharge, and they want to be discharged, but literally have nowhere to live. We're committed to working with community partners, private hospitals, and our state's behavioral health providers to change this. We know we face additional challenges from the Medicaid budget forecast and the growing costs for individuals, and we are committed to improving the processes and transparency in our forecasting, rate setting, and cost control efforts. We are looking ahead to the implementation as well of the Family First Prevention Services Act, which allows federal funds to be used for services to families who are at risk of entering foster care and also aims to improve the well-being of children already in foster care. In every aspect of our work, we are advancing policies and practices to produce the best outcomes for the people we serve while focusing on quality and value in everything we do. We have a lot that we have accomplished together over the last year, and we also realize that our work has just begun. We look forward to collaborating with you on issues of importance to your constituents. Thank you again for the time spent with you today and the chance to offer some comments. And I look forward to a very productive session as we work together. And on a personal note, looking at members of the committee, I want to thank you for your time in helping to educate me as to your concerns, your issues, and your perspectives that I think has been very important as I develop my effectiveness in this role. So I thank you very much for your help in my own development over the last year. So thank you very much, Mr. Chairman, and look forward to a great session together.
Well, Mr. Secretary, thank you for your comments. Those of you that don't recall, this may be one of the most qualified secretaries of health we've ever had. Formerly, of course, helped run the Medical Society as their chair, and then went on and as a cardiologist helped build the cardiology program in Central Virginia, and then on to run the hospital, or at least to be administrator in the hospital, and now secretary. So congratulations. We look forward to working with you.
Thank you so much, sir. Thank you.
Okay, next up is Dr. James Lane, Superintendent of Public Instruction. I think you're representing the entirety of DOE today. So delighted to have you, and enjoyed working with you the last few days. Thank you.
Yes, sir. Thank you, Senator Newman. You may have in front of you, and one of the things that we wanted to share is that we're branding a lot of the new work that we're doing to innovate public instruction around the phrase Virginia's for Learners. And I think we all have heard of Virginia's for Lovers. And Virginia's for Lovers is about getting people to come visit our beautiful beaches and mountains and history. Virginia's for Learners is about getting them to stay because of the great quality public education that we have and bringing businesses with them so that we can continue to develop the Virginia economy. The Commonwealth's approach to education is focused on leading the way and raising the bar so that we can continue to have great public schools in Virginia. We're working on preparing our graduates for college, career, and life. And we're working on the profile of a Virginia graduate and the 5 critical skills that we believe every student needs to be successful in the workforce. Those skills being creative thinking, critical thinking, communication, collaboration, and citizenship. And to do that, we're working to develop deeper learning in all of our classrooms so that students are moving beyond knowledge and information only to analysis and synthesis and evaluation as they share their work. We've had major accomplishments this year at the Department of Education. I've been honored to be here since June. And one of my goals was to continue to retain Virginia's position as a leader in education around the nation. We continue to be ranked in the top 10 by Education Week. Recently, the Cato Institute released a report that when you overlay return on investment, ranks Virginia's public schools as #1 in the nation. Our high school seniors continue to outpace their peers on the SAT and ACT. And another major accomplishment that we've had is the implementation of the new accreditation system, which, to be honest, in my first 6 months was pretty much every waking hour as we worked to implement that. We had a successful implementation of the new accreditation system, and the new accreditation system has some historic components. For the first time in Virginia's history, the state accreditation system measures achievement gaps so that we can ensure that our students from a variety of backgrounds have an equal opportunity to be successful in life after they finish our public schools. We've also focused on growth and how we can measure the success of students that are making steady progress toward the benchmarks. We've also focused on increasing accountability and holding more schools accountable if they are not either meeting our overall benchmarks or our achievement gaps. We've continued to implement the profile of a graduate, and as we've implemented new standards, we've embedded the profile of a graduate and those 5 critical skills into the work that we've done. One of the things that I tried to lead was an advisory committee that helped me transition from the great county of Chesterfield, where Senator Chase is my representative. The Virginia's for Learners Advisory Committee included bipartisan legislators, business leaders, national education leaders to help advise the next phase of what we're trying to do at the Virginia Department of Education. And as I think you may already be aware, we recently received a $9.9 million grant from the federal government to expand our work in early childhood. As we move towards the future, we are focused on a few major goals. The first is to maximize the potential of all students in the Commonwealth and ensure that every student is prepared for a great life. And to do that, we believe that we need to continue to focus on equity and giving every child what they need at the time they need it. Every child what they need at the time that they need it. And so equity will continue to be a goal of the Virginia Department of Education. It's certainly a goal of the Board of Education. They've been studying equity over the past 6 months in committee, and now moving towards the biannual look at the standards of quality. We'll continue to look at the standards of quality with an equity lens. We're also focused on policies to recruit, support, and retain quality teachers. We're aware of the teacher shortage in Virginia and are focused to ensure that we're doing everything that we can to eliminate the teacher shortage. And lastly, we're focused on early literacy. I've already mentioned that we're looking at early childhood education. We've received grants to improve our work, but what we know is that we have to have our students not only ready for kindergarten, but on grade level by the end of 3rd grade. And so those are just a few highlights of some of the work that we're doing. I look forward to working with you through the session. I'm honored to be the state superintendent and am here for you. I do want to take one moment and just introduce 2 members of my team. Many of you know Dr. Cave. who was an amazing member of our team at the Virginia Department of Education. Dr. Cave retired last year, and so while we're seeking her replacement, two members of my team who I think are hiding behind this pole, Zach Robbins and Emily Webb will be filling in for Dr. Cave and are available if you have anything throughout this, any needs throughout the session. Thank you,
Dr. Lane,
Senator
well
Newman.
done. Thank you for coming. We appreciate you. Look forward to continuing to work with you over the next couple of years. And for Dr. Cave, I mean, we've worked with her for decades, some of us, and it may be appropriate, even in her absence, to thank her with a round of applause. We're really proud of Dr. Cave. Doctor, thank you very much. Look forward to working with you.
Thank you, sir.
Next, what we're going to do is there are a few bills that need to be re-referred. One of them, if you will go to your agenda, is Senate Bill 1368. It's the second to the last page, page 4. That bill needs to be re-referred to Finance. It basically just deals with the percentages and reserves in the Virginia College Savings Plan. If you don't mind, there would be a motion to re-refer that bill to Finance. Senate Bill 1368. All right, all those in favor will vote on the voting machine. Clerk will close the roll.
Yeas 13, nays 0.
Yeas 13, nays 0. The bill is re-referred. The second bill will be Senate Bill 1409, which is on the last page. It's Senator Marston's bill, basically dealing with assisted living facilities and requirements for licensure. All of those bills go to rehab. If there's a motion to re-refer that bill. This motion is second. The bill be referred to the Committee on Rehab, and all those in favor will vote on the electronic voting machine. The clerk will close the roll.
0.
Ayes 12, no 0. I meant to vote aye, I think, on that. So, also, for those of you that are in the crowd, they tell me that there are a number of people outside that would like to view the proceedings today. So there is going to be a live streaming going on in Senate Room B in case you are unable to get into this room. Senator Favola, you are signed up first. However, you have a bill that is very close to Senator Donovan's bill, and if you don't mind, I'd like to maybe have those bills taken up together. Is that okay with you if we do that?
That is fine.
And if you want me to call you to have you come down, but I'll be glad to do it. A staff will make sure you don't have to wait here.
Okay, very
Is that fine?
Thank
Good. Okay. With that, that bill will go by just temporarily. Next up, Senator McDougall. Senator McDougall has Senate Bill 1352. Welcome.
Thank you, Mr. Chairman. Mr. Chairman, I try not to visit this committee very frequently. I know y'all have a number of very significant issues. One, I know that Senator Howell and Senator Reeves are working on with foster care, which we heard some about over the interim and is very concerning, and I know that it'll take a lot of your time. But this bill, Senate Bill 1352, has to deal with our Medicaid forecasting. Mr. Chairman, we heard while we were at a session that those forecasting numbers that were mainly around our CCC Plus program were off by almost $500 million. To put that in perspective, you could fund teacher pay increases 10% with that amount of money. So, Mr. Chairman, we've taken steps historically as we've had challenges with the overall budget revenue numbers. There are programs in place like Gaker and Gabe, which many of y'all are familiar with, that ensure that there are outside consultation on the accuracy of those budget numbers. And we even now require, through legislation that passed this body a number of years ago, that the governor provide best case and worst case scenarios for overall budget projections so we can make accurate decisions. The role we've taken through Senate Bill 1354 is to remove from the department currently the oversight and forecasting for the Medicaid dollars, put it in an independent group. That independent group will be accessible to the executive branch, executive to the legislative branch, and everybody in the public will know where those forecasting dollars are. We've certainly seen financially that Medicaid is one of our largest cost drivers in the budget and continues to be the #1 increasing expenditure that we have. This would provide monthly tracking to the executive branch and legislative branch. It would be independent analysis so that everybody would be working off the same page of numbers. And it would be a monthly monitoring so we can know if those trends are changing in any direction. So, Mr. Chairman, I would be remiss if I didn't say that this was not necessarily my brainchild. When I heard about the missing of our Medicaid estimates by such a large number, certainly we'd heard concerns about those forecasting leading up to that. But Mike Tweedy in our finance department was instrumental in drafting this, and the pride of authorship of the specific language is his, and I really want to thank him. I think he's sitting behind me somewhere, over here. And if you have any questions that I can answer, I'm going to tag in my expert.
I have a question.
All right, are there questions to the Senator, Senator Peterson?
Senator McDougal, I mean, basically, your solution to the problem is to create another state agency?
Mr. Chairman, right now, it is currently held in a department that's in the executive branch. So we're going to take it out of that, put it in an independent agency. So we're not going to, it's not going to cost new dollars, which this, if this passes this committee, it'll need to go to finance for the specifics of that to be tweaked, but it is going to become independent. So the agency that's administering the program is not also the one that's forecasting how much it'll cost.
Further question, Mr. Chair?
Senator Peterson.
Well, we have other silos in government such as K through 12 education or corrections or other issues where we may have increasing expenditures every year. I mean, we're going to create an independent agency for them also, or just for Medicaid?
Mr. Chairman, this is only for Medicaid. As you are aware, this is our largest cost driver, and as we went through moving to the new programs, we had estimates as managed care. Those managed care estimates came back saying that it's going to cost us X amount of money. When we actually got the bill, it was almost 450 million plus more than those estimates. It goes, this is different because there's an actuarial type system that goes through, much as you would find in a traditional insurance type situation. So we're going to take that actuarial determination out of the department that's administering it, have it independent. The DOC or K-12 doesn't have that same sort of actuarial type analysis. You might have an analysis as we do through different groups like the prison population forecasting forum, which is a number of individuals, both from the legislature and executive branch, sit on that. You have certain different analysis for K-12 number of students in the program, but the actuarials on the cost of Medicaid is something that is much different and I think needs to be removed.
Final question, Mr. Chair.
Senator Peterson.
Why couldn't DMAS just hire this person? Why do we have to create a new agency? Why, I mean, we already have a DMAS who, they do nothing but administer this program. Why don't they just hire this person or hire a better person if they made a mistake? I just don't understand why we need to create a whole new agency.
Mr. Chairman, many of us felt, including myself, that some of the concerns about the forecasting direction DMAS had presented to us 2 years ago was inaccurate. And some of us expressed that, even had a budget amendment to ask them to reanalyze that direction. DMAS insisted that they were doing it accurately. I personally, and you might differ, don't have confidence that in the administration of the program, so trying to set policy directions, that we're getting the best independent analysis of what those policy directions cost us. And for us to make accurate decisions, that needs to be independent. So, Mr. Chairman, you cannot like the independence of this, but this will be cost neutral at the end of the day because we're not going to hire new people. We're going to transfer the function from where it is currently done, but it will be independent so everybody can work off an accurate, same set of information to make policy decisions.
Other questions to the senator? Senator Sasslaw.
Ryan, let me ask you this. Where will this person or office get their information from? And their information, probably 80 to 90%, if not more, going to come from the Medicaid people?
Mr. Chairman, I would say in looking at how these forecasts are done, there's certainly information that comes through collection, and then there's a certain amount of information that comes from an actuarial analysis. So it is not just about the collection of information, it is also the analysis of what that information forecast out. And Mr. Chairman, that's where I think the independence is important. So DMAS would still do what they do today, which is collect the information on the current populations and what's in the system. What is going to be independent is how that is reviewed actuarially and a determination of what that future cost will be. So that is the part that would be independent.
Okay, very good. Other questions? Senator Howell, yes.
Thank you. We've received in finance several reports from DBAS on what went wrong. And we've also received many suggestions and actually things they're going to be implementing to make sure it doesn't happen again. To me, this seems premature. It may come to this at some point, but now I'd really like to give DMAS the opportunity to correct the errors of before.
Mr. Chairman, I certainly understand Senator Howell's position. Missing the estimates by the magnitude of almost $500 million is a significant enough miss, in my opinion, that we need to go into a new direction and not take a chance that we're going to correct it or get it done accurately. This is putting it independent. It's not eliminating it, not saying we're not going to do it, but this is going to make sure that everybody knows the accuracy of the numbers and can review those more directly. And I think we owe it to the public, owe it to ourselves as we're making these very significant financial decisions to rely on the best possible information, and independence is the way we can get that.
All right. Any other questions? Senator Donovan.
Thank you, Mr. Chairman. It's a little bit more of a comment. I would suggest that this is not at all premature. This is really, really late. In the private sector, you separate these responsibilities to protect both parties. So DMAS, we all know there's a new director of DMAS who is now answering questions regarding decisions that were made years ago that were made by people who may not indeed have the competencies to determine what data needs to go into the actuarial analysis, because it's a very different arena of responsibility in the medical world to look at what those numbers are as you go forward. So I would say, compared to the private sector, I can't believe this wasn't set up a long time ago. And that this is best business practice, best fiduciary responsibility for us as a legislature and a state to make sure that we both get accurate estimates, but also protect those in DMAS that are setting up the programs that we think are so important and necessary, so that we can move forward and have the checks and balances in place, that we're not playing a blame game.
That's right. Senator Black.
Thank you, Mr. Chairman. I understand what Senator Peterson's concerns are about having stovepiped organizations. However, in this particular case, we're talking about such a vast amount of money and such a very dramatic error in estimation that I think we really owe it to the citizens of Virginia to make sure that we are acting responsibly with their funds, that we understand what is going on. It is very common in the corporate sector that you have an independent auditor who comes in and who sometimes gives answers that are not precisely what the corporation would like to hear. But it's done so that the corporate management is operating from a position of full transparency and knowledge, and I think that this is really desperately needed. I honestly feel when we simply come up with the $500 million mistake, I think we really owe it to the voters that we take some sort of action to rectify the problem. And I think this is exactly what we need to do. It's independent, and so I think it's a very, very good idea.
Okay, great. Thank you very much. Now, are there those that are here to speak in opposition to the bill? Okay. Any other comments by the committee? All right, there's a motion and a second to report and re-refer. Senator Barker.
Yeah, just to offer some comments on this. I mean, obviously, this is a significant issue, and it's been somewhat of an issue over a few years dealing with this. And I was one of those that, along with you and others, had some concerns about the projections as it related to the CCC Plus. We did get the former administration to bring down the amount of savings they projected to happen immediately, but they did not eliminate them, which clearly turned out to be a mistake in that situation. And I wish they had listened to us a little more fully back then. What I can say is I think there are a lot of things that are happening and have been happening over the last couple of years that are moving us already in the right direction on these. We did set up an HHR oversight subcommittee that has 4 Senate members, including Senator Dunavant and Senator Howell, along with myself and Senator Hanger, as well as 4 House Appropriations members. And we are making significant progress of getting the information now to be able to provide a lot more of the oversight that had been, that we did not have previously, and in many instances did not have the information to be able to do that. We have clearly, I think there was a good faith effort made by the current administration in coming forward with this and in building into this calculation not only some of the things that have already happened, but some of the things that they understand are likely to happen, and also taking into account the costs, the reimbursements that we've already gotten for 2 state mental health facilities, Catawba and Piedmont, that we've known about for years that we were probably going to have to pay back those monies, but we had never factored them into the budget in the same way. And so I think that, there are a lot of things that are happening to address that. I've been involved with some meetings with people in the administration to make sure that I'm much better understanding these things much more thoroughly. And I think that with the subcommittee we have and our HHR subcommittee as well, there are a lot of things that we are doing. What I would think would make more sense is to, rather than go forward with this specific proposal right now, is to continue down this path, but keep this as an option should we not be able to resolve this in a better way going forward. There have also been some significant changes in the operation within DMAS. They've replaced the consultant that they use, who was tied in with some of the issues in terms of the CCC Plus, and now have a consultant that they're working with on a constant basis as it relates to these issues that has much more experience in terms of dealing with Medicaid in a lot of states across the country. So I think there are some significant progress being made. I think certainly there's good faith step forward and admit what the problems have been here, and there is an action plan and efforts being made. There was a recent 2-day conference or 2-day session retreat of all their key staff people to get on top of this and try to make sure that these types of things are not repeated in the future. And not only has Secretary Kerry been involved in helping provide oversight and guidance on this, but Secretary Lane has also been involved. So we're making sure that it's not just within this secretariat, but also from the perspective of the Secretary of Finance as well. So I understand and sympathize 100% with your concerns here. I just think that we're making progress in terms of being in a better position, and now may not be the most appropriate time to do this, but I guarantee you if it doesn't turn around fairly quickly and we continue to have these problems, I'll be happy to sign on as a co-patron on this type of thing.
Mr. Chairman, if I could just make one final comment, and that would be, I certainly think Senator Barker expressed a point I should have led with. This did not originate under the current administration. So this was a previous administration. I think some of Senator Barker's points are accurate, but the question is, do you rely on the personalities that are in place that are working diligently to resolve the problem, or you change it systemically to make sure that the system is set up so that regardless of the personalities that are in place, it doesn't happen again? This bill would still give the governor the appointment of the director of this independent agency. the General Assembly, the confirmation of that individual, and sets up a system, not personalities that are working diligently now to ensure that this does not happen again. I think it's incumbent upon us to set up a system that prevents this, not just rely on individuals that are working really hard to fix a problem that occurred with different personalities.
Okay, great. Are there other comments? If not, Senator McDougal, the motion is to report and refer to finance, and I know if it goes upstairs, a lot of the same people will have a good discussion about the items that we have. Also, it's clear to me that the General Assembly has a little culpability in this too. I mean, we agreed to the numbers, right? We were kind of okay with them when it happened, and so this is also a bit on us as well. So the motion and second is that the bill be reported and re-referred to finance. All those in favor vote aye. Those opposed, no. Dick, you'll vote no, probably.
Can I open it again?
My machine doesn't work, but I'm yes. So,
Mine doesn't work either.
and you're a no, right? All right, clerk will close the roll.
Mine was registering the vote as closed before we closed it. Can you strike it?
Can you strike it? Okay. Clerk will strike the roll, and we will try again. All those in favor vote aye. Those opposed, no. Clerk will close the roll.
Okay.
Ayes 8, nays.
Ayes 8,
There you
nays
go.
nay, 7.
All right. The bill is reported and referred.
Thank you,
Senator.
Mr. Chairman, members of the committee.
Very good. Just one more housekeeping item before Senator Reeves comes up to speak with us. We have on our agenda Senate Bill 1055 and Senate Bill 1148. Both of those two bills deal with the DACA situation. We considered both of those bills last year. Senator Marston has asked that he be allowed to bring in some advocates for that. So we will let, without objection, Senate Bill 1055 and Senate Bill 1148 go by for the day. Next up is Senator Reeves. Senator Reeves, good morning and welcome on Senate Bill 1249.
Thank you, Mr. Chairman, members of the committee. Senate Bill 1249 is the genesis of some work product that came out of the Virginia Military Advisory Council based on all the military commanders of the 33 installations that we have in the Commonwealth of Virginia. And we've been asking them, in order to try to stay as the most veteran and active duty friendly state in the Union, how we can do that. And one of the issues that came up was when our active duty military personnel move into the Commonwealth of Virginia, their enrollment process has been hindered to some extent. And so we came up with some language. We thought initial language was really good. And working with the administration, they had kind of a little bit better idea of how to craft it. So there should be an amendment in front of you. So if we could accept the amendment in the nature of a substitute, that would be great.
Tom, will you report the amendment?
Thank you, Mr. Chairman. Senator Reeves. It's essentially moving the new language in subsection C into subdivision B3. So after on line 85, after tuition, insert students eligible to enroll in a school division pursuant to this subdivision may register remotely or in person for courses and other academic programs and participate in the lottery process for charter schools and college partnership laboratory schools in the school division in which such student will reside at the same time and in the same manner as students who reside in the local school division.
Move the amendment.
There's a motion second that the amendment be agreed to. All those in favor will say aye.
Aye.
Opposed, no, and the amendment's agreement. Senator Reeves?
Mr. Chairman, members of the committee, what this thing does, you're probably like, why do we need this? This just standardizes that process for our military families that are moving into the Commonwealth for all the jurisdictions, so we don't have a kind of, I hate to use the term hodgepodge, but a standard operating procedure for all the school districts, the same standard, because we do have military personnel that are transferring in all kinds of different places throughout the Commonwealth. So that's
Senator Reeves, you still have the requirement that the parent notify the school division within 10 days of actually establishing.
that is all
residency.
still there. This is just an addition to that to standardize it.
Thank you very much. Are there those that are here to speak in opposition to the bill? If not, what's the motion on the amended bill?
Move to report.
There's a motion and a second that the bill be reported, that being Senate Bill 1249. All those in favor will record your vote aye. Clerk will close the roll.
Ayes 15, nays 0.
15-0, the bill is reported. Thank you, Senator
Thank you,
Reeves.
Mr. Chairman.
Next up is Senator Hanger. Mr. Chairman, thank you. Apologize for keeping you waiting, but glad to have you here.
Quite all right, Mr. Chairman. Interesting and relevant conversation y'all were having there, so please to listen in on it. I have in front of you this morning Senate Bill 1314, which deals with the Commonwealth Center for Children and Adolescents that we have, where we have 48 beds there, which you are familiar with. And the issue is the education of these children. There's a requirement that an education program be provided to the children, but there are issues at times. And that facility now, unfortunately, because of the demand, is experiencing admissions of in the 900 a year range when there are only 48 beds. There's a lot of cycling and recycling. There is a problem inherent in the admissions process there because currently parents or guardians are required to sign off on their enrollment in the educational programs, and that just doesn't happen in a lot of instances because of technicalities of distances and inability to communicate, or in many instances dysfunctional parents, which are a part of the problem generally, and the reason why they're there to start with. So this bill quite simply will allow them to be enrolled without a written authorization from the parents. It's to streamline the process. Essentially, they have to have that authorization from a parent or guardian on file. A lot of children are not able to attend school because of that, and they're missing out on opportunities because you have their faculty that are very helpful to the children, and it's disruptive because it denies them the opportunity for the better school experience that they can have there, and it distresses the children who, because of the fact they don't have this signed document in the file, are not able to attend class in their brief stay there. So that's the simple essence of the bill.
Great. And the religious exemption is still taken care of in the bill, is that right?
That is
Okay.
correct.
Are there those that are here to speak in favor of the bill? Are there anyone here to speak in opposition to the bill? I don't think there's any amendment needed for this, Tom.
Second.
There's a motion and a second that the bill be reported. All those in favor will record your votes aye. Those opposed, no. And the clerk will, maybe someone vote Senator Sasslaw. Okay. You do it on the, all right, good. Close the roll.
Yeas 14, nays 0.
14-0, the bill is reported. Mr. Chairman, thank you for coming by.
Thank you, Mr. Chairman.
Up next, Senator Wagner. Welcome, sir.
Thank you, Mr. Chairman. I have Senate Bill 1358 for the committee.
1358, local providers. That's good. Yes, sir. Go ahead.
Let me give you a little background, Mr. Chairman, and the committee, if I could. I think every one of us would love to see the quality of health care improve and the costs go down. And I think we shared, and that's certainly a bipartisan type operation. And also, when we find something that works, we ought to look about replicating it. So I want to talk about a little program that goes on at Huntington Ingalls Newport News Shipbuilding that you may or may not be aware of, but I had the opportunity to tour. They have set up their own clinic right outside the gate. And employees who have all the health insurance there can maintain their own primary care physicians, do what they've always been doing. That's not a requirement, or they can use the clinic, okay? And the joy of the clinic is that when you use their clinic, it has 4 primary care physicians, 4 nurse practitioners, a lab, a CVS pharmacy on site, and I'm explaining the Newport News program. Your copay is $15. That's it for everything. That includes lab work, everything that you do. Your prescription pharmaceuticals within there from CVS are $3 and $6. That's all your copay for your pharmaceuticals, whether they are generics, $3 or $6 for the prescription ones. It has saved Newport News Shipbuilding a tremendous amount of money. Even Mr. Cosgrove, who we all know represents them on behalf of government affairs here, he goes and sees his primary care physician, but he buys his pharmaceuticals from the CVS pharmacy right there on site. He also refers all his lab work from there because the savings are so great. What's happened with Newport News Shipbuilding is they've seen a savings between their 2 shipyards, one in, obviously we're aware of in Newport News, the other one in Pascagoula, Mississippi. close to $200 million a year. But more importantly, the outcomes they're having are far better. Unfortunately, it's an experience across the country. There's a lot more diabetic patients around than normally. They have a nutritionist right on site. So when you go in to see the primary care physician, the nutrition is there. You get the total treatment package. You don't have to re-refer. They have an occupational therapist on site. They have put this facility together at their own expense as an investment, expecting to get a return on investment, and that would be better outcomes for their employees in terms of health, and also reduce costs to the company for operating a healthcare system. It has, and it's been in operation now for 2 or 3 years. I would encourage, and they'd be delighted to give everyone on this committee an opportunity to tour that facility down there and see how it works. They even have an on-site dentist now and dental technicians. It's been so successful, they brought that in. So what this bill does is allow a locality who might want to go down this road to do the same thing. Doesn't require localities to do it, but it's an opportunity. You have to have a mass of a certain amount of employees, and obviously, a city like my own, Virginia Beach, with some 12,000, 5,000 city employees, 7,000 school board employees, you're talking about 12,000. You have that critical mass within the city of Virginia Beach. Fairfax would be another one. To put one of these into place and provide better outcomes for the employees and their families use this also, provide better outcomes for the families, the convenience of that, the loss of work time, the ability to be able to go, outside the city manager's office or one of the offices, walk over to the clinic, come right back to work, get your prescription, come right back to work. If there's occupational therapy, get that and come right back to work. It has been a time saver, a money saver, but most importantly, it has been an opportunity to talk about lifestyle changes to their employees, which ultimately is leading to better health. And already the trend lines are down in terms of the incidences of diabetics having more problems and those types of things. So the program is working. It's saving money, and it's offering a better outcomes for the employees of Newport News Shipbuilding. We know it works. We've seen it work. There are companies, they've hired a company that manages this. And so I think it's something we ought to make available to localities who have that critical mass of employees and the health insurance premiums to do that. So, and it doesn't require anybody to do it. It certainly opens it up.
Senator Wagner, thank you very much. Other questions? Senator Peterson.
Yeah, I had a question. First of all, this is a friendly question because
Sure.
this does sound like an innovative idea.
Good to have a friendly question from
It
you,
is.
Senator.
It's been a while.
I suspect we'll have a few others.
Yes, sir.
Okay.
My question is, why can't they do this now? I mean,
They
is this a
probably
Dillon
can.
rule or?
No, they probably can. This just clarifies that it does, and hopefully by putting this into place, encourages folks to take a look at this
Okay.
that might
And then-
not have already looked at it.
Just a
Peterson.
quick follow-up question. If a locality, let's say Fairfax County was to offer this,
Right.
would you imagine that this would be the sole provider, or would they still have access to their own primary care physicians?
Like I said earlier, when Newport News put this in place, employee can choose that, or they can continue on with their existing insurance. They're truly, if you like your physician, you can keep your
Right,
physician
I've
with the
heard that.
Newport News
Okay.
program, okay? Didn't want to bring that bad one up, but that,
right.
under the program that's operating, yes. What they've seen is because of the convenience factor, the factor that they don't find themselves waiting in doctor's offices, they don't have to travel, and I know running across Fairfax to see your physician can
Right.
be an all-day event, and then half a day coming back.
Right.
The convenience factor of it and the cost savings, out-of-pocket cost savings for the employee, it's what's driving many, many employees to do this. But if you have a primary care physician you're happy with, you stay with that and take advantage. As I said, Tom Cosgrove, who we all know,
Right.
Works the halls here, he kept everything, but he buys his prescriptions. He sends his prescriptions to the pharmacy on site and also directs his doctor to send the lab work to the lab, simply because the savings are so much for his out-of-pocket expenses. And I think that's the key, is it's saving the employees a lot of out-of-pocket money also.
Senator Peters, does that complete your questioning? Good. Senator Cosgrove.
Thank you, Mr. Chairman. Actually, the Chesapeake School Board already has a pharmacy that is there for their employees' usage, and the employees use it a lot, and they save a lot of money. The school system saves a lot of money with this as well. This makes perfect sense. And of course, Newport News Shipbuilding, Huntington Ingalls, is already doing this. I think this is going to give localities quite a bit of leverage to increase the benefits of their employees and also help the wellness of their employees. So I hope we'll support this, and I will make a motion to report the bill.
Okay.
Second.
All right, there's a motion, a second to report. Senator Black.
I don't have any.
Okay. Is there, before we maybe just hold the motion, is there anyone that came and would like to speak in opposition to the bill, that being 1358? Hearing none, there's no amendment necessary. There's a motion and a second that we report 1358. All those in favor will record your votes aye. Those opposed, no. And the clerk will close the roll.
Ayes 15, nays 0.
15-0. Thanks, Senator Wagner. Thanks
Thank
for
you,
coming by.
Mr. Chairman.
All right, up next, Senator Stanley, and if the clerk would not mind giving Senator Favola a call to have her return. She and Senator Donovan have a similar bill. Welcome, Senator Stanley.
Thank you, Mr. Chairman, members of the committee. Senate Bill 1000 is a bill that you've seen before, and I am relentless and will not give up on this. You have passed this out of the committee because it is such a great idea, and when I have great ideas, they're very few, and so I must continue to push them. Senate Bill 1000 basically allows the TANF money that we receive as a block grant from the federal government to be used in a pilot program to fund the college education in our community colleges for 200 students. Those students would be students who meet or in TANF eligible families. Right now, just on my research, there's a current projected TANF balance of $112 million in fiscal year 2020. I'm seeking 200 community college scholarships for people in underserved and underprivileged areas at a maximum of $4,000 per year. So what we're asking for in the pilot program to see if we can make this work for those children that are living at or below the poverty level and whose families receive temporary assistance for needy families, to see if we can help them break the cycle of poverty. And as you know, and we all know and believe, we believe that education leads the way in breaking the cycle of poverty. And in my area, quite frankly, and I think there were a lot of students that would benefit from this, college is out of reach. That $4,000 is something that not even they can afford or their family can afford. And so what they usually are thinking, and the students that I've talked to as the chairman of the board of directors for the New College Institute, is that they believe that college is too expensive. So starting in about 8th, 9th, 10th grade, the expectation is not, I'm going to go to college, because they know I can't afford it, my family can't afford it. So they start looking in different ways to be productive, or they don't think that they can achieve the dream that they may have had since they were young men and women. What this basically does is taking unused money, because from that block grant of money that we get from the federal government for TANF, we then appropriate it for other things. I think there is nothing better for us to do than to appropriate it for some child, some young man or young woman to go get maybe a credential from our community college or a 2-year associate's degree to encourage that further learning so that they can go out and get a job and in effect break the cycle of poverty that their family is living under and in effect break that cycle for generations in their family to come. So what this program will also do is it would be implemented in 2 or more community colleges, one in a rural area and one located in an urban inner city area. So what we're trying to see is if we can change the dynamic of how we produce the ability and the opportunities for education, especially at those living at those levels of poverty, irrespective of their zip code, that we can actually create a workforce, a pipeline of workers that ultimately, as we believe at the new college, that if we can create a pipeline of workers, workforce trained, educated, highly educated, that's not only going to get them jobs, it's going to bring industry into those inner cities and into those rural areas. This scholarship hopes to set the table for that which we can do in the future. And that's the bill, Mr. Chairman.
Thank you, Senator Stanley. I don't believe there's any amendments. This committee passed this and sent it up to finance last time, 15-0. Is there anyone here to speak in opposition to the bill? Okay. Know this, I mean, TANF money isn't free, but I think our HHR subcommittee will watch over it very carefully to make sure. But last time we determined it was in our best interest to do so. So with that, is there a motion on the bill?
Yes, Mr. Chairman, I move to report and re-refer to finance.
There's a motion and a second that we report and re-refer to finance Senate Bill 1000. All those in favor will record the vote aye. Those opposed, no. And the clerk will close the roll.
Thank
Thank you, Mr. Chairman. Thank you, members.
Ayes 15, nays 0.
Ayes 15, nays 0. The bill is reported and re-referred. Is Senator Favola here yet?
She's on her way.
Pardon?
Mr. Chairman, she's on her way.
Okay. If, because we're down to where, I think, Senator Peake, we have one from you. Are you ready to go with yours, sir?
Chairman, I actually am not, and I was going to ask the chair to pass this by for the day. We are having a question about 2 or 3 words on this, so I'd like a chance
All
to
right.
clear that up.
Senate Bill 1106 will go by for the day without objection. Next up, Senator Barker, you have 1298. Are you ready to go on that, sir? Okay.
Thank you, Mr. Chair. I have Senate Bill 1298, and I do have some backup here to help out with any particular questions if need be. We've had a good bit of discussions over the last few years related to information in terms of suspensions, expulsions, those types of things within the school systems. What we've not had, and many of the times when we've been debating that with Senator Stamlin and others being presented these types of things, is that we've not had a full understanding of what happens to these students when they are suspended or expelled and where do they go from that, because that has not been data that has been required to be reported by all the school divisions to the Department of Education. What this would do is set up a process to have that data reported on a regular basis, to get an understanding of the alternative education programs and other types of things that in many instances are provided, but in many instances are not provided right now. And to be able to measure that and try to make sure that we have the alternative things so that those students who are suspended or expelled or otherwise removed from the schools on a temporary or permanent basis, permanent in some instances for their individual school, but then maybe placed in a different setting, that we know where they're going and what their academic progress is and what the outcomes are long term. And I do have someone here who can help answer any questions if anyone might have that on that. As far as I know, the Department of Education and Administration is not opposed to this in any way. There may be some minor cost on this, so it may need to go up to finance, although I've not had any request for that yet. So.
Yeah, I don't think it does unless you have a need for it to go. So those are here speak in favor of the bill.
Good morning, Mr. Chairman, committee members. Amy Woolard with Legal Aid Justice Center. I appreciate all of the discussion that happened in prior sessions over school suspension, and certainly I'm not seeking to open up that chapter again, but I think that this bill really looks to the next chapter to answer the question, what is happening to these children after they are suspended or reassigned? For a lot of our clients, because there are no minimum standards or way of sort of tracking the quality or transparency of these programs, we see, for example, elementary students being assigned to programs in local strip malls that start at 5 p.m., 6 p.m. in the evening, where there isn't transportation and there are safety concerns. A lot of kids remaining on home-based education for years at a time, where if a tutor comes by at all, it's usually once a week for a couple of hours with some worksheets. So we really just see this as a sensible first step. Let us see what we're doing in the Commonwealth. If we're making these investments in these programs right now, we should know what they're doing. We should know where these kids are, and it will help us kind of build a better program in the future. Thank you.
Very good. Thank you for coming. Well done. Are there those here that would like to also speak in favor of the bill 1298? Welcome. Hello.
Thank you. Thank you. Good afternoon. I'm sorry. Good morning, I should say. My name is Candace Lucas. I'm an advocate with Advocates for Equity in Schools. We primarily support families of color and a predominantly amount of individuals that are referred to these schools are children of color and children with disabilities. And what we're finding is that the schools do not meet the criteria regarding the requirements for educational rigor, and they do not provide the supports that are required, and they still bill taxpayers and get paid astronomical amounts of money. So this data will prove to be very effective, and to be honest, it will prove to provide the information that's needed to keep the kids in public schools, because we can model those programs and get them in place so that the public schools can be the one-stop location. I'm also a former educator in alternative schools, so I know the nitty-gritty. I know what goes on behind closed doors, and I know what happens, and I know that individuals in those programs usually are not qualified to teach our most at-risk youth. So I'm in full support of this bill, primarily for children of color, and to dismantle the Virginia school-to-prison pipeline. Thank you.
Okay. Thank you for coming. Others that are here speak in favor of the bill? Those that are here to speak in opposition to the bill? Does the committee have any questions about the bill I hope we would pass it. I mean, we need better metrics, and George, what you're doing is getting us a metric to make good decisions. But anyone, Senator Lucas?
Oh, no, I love the bill. I was just going to recommend that the bill be approved.
So you motion to
I make a
report?
motion.
And
Yes,
there's a
motion to
second?
report.
Is there any other comment, committee? Senator
Yes,
Donovan?
Mr. Chairman, thank you very much. I'll just comment briefly that were it not for our bill limit this year, I too would have introduced this bill, and I think maybe Senator Stanley would have as well. So I appreciate Senator Barker doing it, and I aspire to co-patron. It's really, really important that we make sure every kid in Virginia has a chance at an education so they have a chance at a future. And so we need to just stop tracking how many kids maybe are in some sort of suspended educational process and really figure out what we can do to make it better for them. So I think it's a great first step that is already data that's available that we can just actually track and have awareness of. So thank you, and I support the bill.
Okay, there's a motion and a second that the bill be reported. All those in favor will record their votes aye. Those opposed, no. And the clerk will close the roll.
Ayes 15, nay 0.
15-0, the bill is reported. Thank you, Senator Barker. Up next, we have two bills, which is Senate Bill 1134 and Senate Bill 1258. If we could just get a joint presentation. One bill is just a little more narrow than the other one. Both of them go after the same item. Because the Favola bill is a little more narrow, maybe Senator Favola, do you mind going first? No, we were just and then we will hear from Senator Donovan, but both of them have the same thing. Donovan's is a little bit broader, but I do hope that whichever one we roll together and send up, that we will send it to Finance because we need to figure out the funding, and they've requested that. So Senator Favola, welcome.
Thank you, Mr. Chairman. I have one amendment, and it's minor. I know you always say an amendment in the nature of a substitute, but on line 161, I would like to delete assistant behavioral analyst.
All right, so wait, could we just wait? Tom, do you have that amendment?
Thank you, Mr. Chairman. Senator Favola, starting on line 160, after behavior analyst, strike licensed assistant behavior analyst.
That is correct.
Just, we're going to roll these bills, but is there a motion on the amendment? Okay, there's a motion and a second that the amendment be agreed to. All those in favor will say aye. Opposed, no, and the amendment's agreed to. So Senator Favola.
Thank you, Mr. Chairman. What my bill does, and it is very narrow, is under the category of support personnel, it includes licensed behavioral analysts. So it is completely up to the school systems whether or not they choose to hire a licensed behavioral analyst under their support category, their support personnel category. But it's all my bill does is make that an option. Licensed behavioral analysts are professionals who are trained in working with behavioral issues. It's important to have access to these professionals because oftentimes students, when they have behavioral issues, unfortunately are suspended or given punishment that really takes them away from a learning environment, and that's not good. So our goal should be to create an environment where every child can learn and flourish and succeed, and I think licensed behavioral analysts can be a part of that scenario. I do have two speakers. I don't know if you'd like to hear from Senator Donovan before my speakers come forward.
Why don't we do that? Because I think the subject matter is similar, right? And I think it makes some sense, but let's have Senator Donovan.
I just want to be clear. Forgive me, Mr. Chairman, I just want to be clear. Mine does not have a fiscal impact because it's optional for the localities. Just want to be clear.
And you are correct on that. Senator Donovan's does. We're going to have one policy coming out, but we'll work on that in a little bit. We'll make sure we're there. So Senator Donovan, do you mind sharing with us your bill and mostly the differences on the required portion of that, right?
Certainly, Mr. Chairman. And the difference between my bill and Senator Favola's is mine is more directive, that I actually think behavior analysts in the schools are so important that I've asked the school systems to have one behavioral analyst for every 5 schools. And the reason that I thought that was so important is I convened a K-12 work group in my district this year, and when we talk about some of the issues that we have in school, teachers will articulate that their greatest challenge is managing behaviors in classrooms, and that if they could accomplish that, they could keep more kids in the classroom, they could more successfully teach all kids. It is one of the #1 things that demoralizes teachers is that they have a hard time handling the behaviors in their classes, and they are not trained to do that. But behavior analysts have special licensing and training to make sure that they can go into those classrooms and build a relationship and a context where the teachers can succeed and educate all the children. So I think it helps our children succeed. It creates less of a teacher loss rate that we have. It deals with issues of suspension, and I think it's just really important for schools, and that's why I was directive in the ratios.
Okay. Are there those that are here to speak in favor of the concept of the bills? Welcome.
Mr. Chairman, members of the committee, I'm Kathy Bircher with the Virginia Education Association. We are extraordinarily grateful to both Senators Donovan and Favola for bringing this issue forward. We certainly understand Senator Favola's effort because we agree that these are important positions to have in the school division, and a lack of fiscal impact certainly helps us move in that right direction. The VEA believes very strongly that there needs to be structural changes to the standards of quality to assure that the positions are in place that our students need. And as we've really looked at decreasing suspension rates and expulsion rates and ensuring we keep our students in our public schools, we believe that these required positions should be included in the SOQs.
Okay. All right. Others here to speak in favor?
Good morning once again. Once again, my name is Candace Lucas with Advocates for Equity in Schools. Behavior analysts must be a core content, a core part of public schools. It is not optional. This is the one step that this committee can take and the General Assembly can take to dismantle Virginia's school-to-prison pipeline. As you are aware, Virginia is #1 in the nation for referring Black and brown bodies to the school-to-prison pipeline as young as the age of 4. And I have a client that's 4 years old that's been suspended 60 times in Henrico. And if we had a behavior analyst to assist educators on how to address that issue, it would have made a complete difference in the life of our child. As a licensed educator and administrator by the Virginia Department of Education, I took the initiative to learn about child development and issues as far as interventions for children that have anxiety, that have mental health issues, that have oppositional defiance. It is not something that is taught in our teacher preparation programs. So a behavior analyst is a requirement. It is not optional. And I encourage this bill. I'm very grateful for the bill to be proposed, and I encourage this committee to refer it.
Great. Are there others here to speak in favor of the bill? Welcome.
Hi, my name is Christy Evenko, and I'm a licensed behavior analyst, and I'm the administrative director for the Virginia Association for Behavior Analysis. We weren't aware of Senator Donovan's bill, although we thank you very much for your support. We did ask Senator Favola to introduce the bill. We have currently about 1,200 licensed persons right now. That's about 1,100 licensed behavior analysts, about 100 or so licensed assistant behavior analysts. We do work, there are a lot of us now that work within the schools, although unfortunately we aren't able to be hired at this time if we don't have a teaching license. So that's something that we thought that this bill could correct, that they could hire us as behavior analysts doing the things that we know how to do and not as teachers who also do behavior analysis. So I'm not sure I understand all of the ramifications of the other bill because I haven't looked at the numbers, although I knew we have only 1,200 licensed persons. I think there are 2,000 schools. That would be about 400. I'm not sure how that would work, but we are absolutely in support of this, and we really thank you for noticing our profession and the work that we can do.
Mr. Chair.
Thanks for coming by. Yes, Senator Peterson.
Could I ask a question?
Yes.
What is a behavior analyst? Is it a psychologist, a counselor? I mean, what is it?
I actually had the definition from
Okay.
code. It says that it's one that designs, implements, and evaluates environmental modifications using behavioral stimuli and consequences to produce socially significant improvement in human behavior, including the use of direct observation, measurement, and functional analysis of the relationship between environment and behavior. I didn't know what they were either until I met with my teachers, and they were so resoundingly in favor.
Very quick
Yes, Senator
further
Peterson.
question.
Yes.
And we have a licensing process at the state level?
They have been licensed since 2012, and yes, they're licensed by the state.
And is there typically a graduate degree that's required, or what? Sure.
So yeah, there are actually 3 levels of behavior analysis. It goes to the Behavior Analyst Certification Board, which is an international board. And the first thing that happens is that you have to have a master's degree to be a behavior analyst, that level. There is the assistant level, which is a bachelor's degree. Then you get extra education on top of that. There's a required task list. I don't want to go into all the details of that,
Sure.
but we have extra education on top of that. And then similar to a licensed social worker worker, a counselor, we also have some supervised experience, a certain number of hours of supervised experience. After that, we take a board exam, and then we either pass or we don't pass the board exam. Then you become a board-certified behavior analyst.
Okay.
And that is what is necessary to become licensed by the Board of Medicine. They take that board certification. So yes, there's a significant amount of extra work
That's
involved.
very helpful.
And
Thank
then
you.
last year, there was a law that was passed that included us in the licensed mental health practitioners definition, just because we fit that as well. So we work in a lot of different areas. Most people know us with respect to autism, but you know, just like gravity doesn't only apply to kids with autism, behavior also doesn't only apply to kids with autism. We're a natural science as opposed to a social science. So behavior, of course, goes across everything.
Great, I appreciate that.
Thank you.
Okay, are there any others that are here to speak in favor? Hey, welcome.
Good morning. My name is Mike Asip. I'm representing the Virginia Council of Administrators of Special Education. I come in support of Senate Bill 1134. We believe that the licensed behavioral analyst can be another support, and all it puts in the SOQ is that option to utilize those, not to mandate their ratio or their requirements to be in the schools. So we do support them as one of the tools that schools and the flexibility that schools would have and school divisions would have to have licensed staff, some additional staff who have expertise in behavior challenges working with our students. So we support 1134.
Thanks for coming by today. I appreciate it. Is there anyone here to speak in opposition to the bill? Welcome.
Chairman Tom Smith, Superintendent's Association. I'm not here to speak against the use of behavioral specialists in schools, and we do have schools that go ahead and employ those with local funds right now. But if we're going to move in on a statewide basis, it's our hope that cost would be looked at and funding for these programs, because even if it is under the support cap, I use that word, support cap. Remember, the support positions are capped in a certain percentage. So we would hope that, and assume this would go upstairs. Don't want to assume it, but you know that it could happen. And cost is going to be a factor, as good as these positions are, with school divisions being able to employ.
Thank you for coming by. Others that have some concerns about the bill?
Mr. Chairman, Stacey Haney with the Virginia School Boards Association. We would support Senator Favola's bill that adds these positions to the positions that can be utilized for the state funding. What we have a concern with is mandating that this type of position be utilized as opposed to other types of positions that schools might use to deal with these issues, such as school psychologists. So I think we just need to look carefully at what comes out between these two bills, but we would definitely support additional state funding to allow school boards to hire behavior analysts or other types of positions that could also address behavior problems.
Great. Thank you for coming by today. Anyone else that has some concerns about the bill? Welcome.
Good morning, Mr. Chairman. Jeremy Bennett with the Virginia Association of Counties. We just echo that we would like the intent of the bills, but if they are required of our local school divisions, that there is additional state support for those positions. So,
and just thank you for that. Those that are here, if the bill does report, we do need to send it to finance, and some of those issues that you just mentioned will clearly have to be dealt with upstairs.
I'm sorry, Mr. Chairman. I have submitted a budget amendment for my bill.
Very good.
Mr. Chair.
Yes, Senator Cosgrove.
I'll defer to Senator Black.
Oh, Senator Black, go ahead, sir.
I have, it's sort of a general philosophical concern. I know over the past 2-3 sessions, we have addressed our concern over those children who are expelled from school or put in some alternative situation because of their behavior within the classroom. And while, you know, certainly it's noteworthy and worthwhile to show compassion for these kids, I am concerned about the teacher who deals with a disruptive student. And there was mention of a child who had been suspended 60 times. I feel rather confident that that child has had a major negative impact on the other students in the classrooms that child has been assigned to. And while, you know, I certainly sympathize with children who are disruptive, I am deeply concerned about the challenge faced by individual teachers who have to maintain order, who have to maintain a position of authority within the classroom, authority which is greater than that of some misbehaving child whose inclination is to sort of seize control of the class dynamics and to interfere with the learning process for all of the good children who are in there, whoever they may be, and, you know, whatever their category. I'm not concerned about you know, anybody's, you know, what their particular background or racial component or anything else. But what I am concerned about is that every child who really wants an education, whatever community they come from, that they get that education and they're able to do it without disruption. And, you know, I think back to when I was a kid, and, you know, there were a couple of times that I was told, get out of the class. And while I think my conduct was rather innocent at the time, I never felt any sense of irritation with the teacher. The teacher was the authority figure. She said, get out. I got out. And I just thought, well, you know, is there something I need to do to rectify my behavior? And I really would like to see teachers have that authority without being disrupted. So thank you very much.
Thank you, Senator Black. Any others that would like to,
Yes, Mr.
to speak? Senator Cosgrove, yes.
Thank you, Mr. Chairman. I'm going to make a motion to roll Senate Bill 1134 into 1258 because 1258 obviously is broader and has a financial impact that will have to go to finance. If there are issues that can happen in finance, then y'all can figure it out. But since Senator Dunavant's is broader, I think that's the way to go. And so my motion would be to roll 1134 into 1258, and then I'll make a motion to report and re-refer to finance.
But if we do that, could we just make sure that Senator Favola is the chief
Absolutely,
patron or
and
chief
absolutely,
patron? Is
yes.
that okay? All right, there's a motion and a second. We roll the two bills together. All those in favor say aye.
Aye.
Opposed, no. And the bills are, do we need to take a roll? All right, well, all those in favor record your votes aye, those opposed no, and the clerk will close the roll.
Mr. Chairman, then I'd make a motion to report the bill as amended, rolling in, and re-refer to finance.
Okay.
Mr. Chairman, if I can just make one comment.
Yes, Senator Donovan.
Regarding Senator Black's comments, that's exactly why this bill is being presented today, is that the teachers asked for the tools to help them manage and maintain authority in the classrooms, and they don't get that in their education, but this is an adjunct tool to maintain that sense of collaborative learning in a classroom that teachers don't have. And those that have behavioral analysts are so grateful for the changes they've made in their classrooms.
Okay, any other comments? Senator Donovan, I just want to make sure, I want to be open with you, both of you. I still have a number of concerns, not about the process, not about the use, but about the funding, right? Because we really do have to be very, very careful of that. And I think that we've got to watch some of the items that Senator Favola you had in your bill I kind of liked, and some of the items you had. So we've got to watch the funding. It's easy for us up here to agree to all kinds of great things, but the localities have got to pick it up. But with that, there's a motion and a second that the bill be reported and re-referred to finance. All those in favor will record your votes aye. Those opposed, no. Let me change Cosgrove to yes, and change me right now to a no. Okay, clerk will close the roll.
Yeas 13, nays 2.
All right, 13 to 2, the bill is reported and referred to Finance. If you don't mind sticking around for just a couple more minutes, I'm going to present a couple of bills and turn it over to Senator Black.
All right, Mr. Chairman, I believe you prefer to start with Senate Bill 1213.
We will. Just, Mr. Chairman, if you don't mind, Senator Locke and Senator Barker and I have a similar version to Senate Bill 1214. We've decided not to bring that one to you today, and we'll have a discussion. Some of those bills are in courts, and some of them are here, and I've asked the Courts Committee and the chairman send them here. We'll have a discussion here. But we're not going to take them up today.
Thank you.
Mr. Chairman, if you are kind enough to allow me to present to you Senate Bill 1213. These bills come to us as a result of the study that occurred about school safety. That was a bipartisan group, and also the Senate and the House participated in that process. This bill, Senate Bill 1213, relates to the threat assessments, and this bill would include case management tools in that process. As most of you know, the case management tools are aggregators in ways to bring together all the information. It has been very helpful in a number of locations. This bill currently in the code, we have under the threat assessments, anti-bullying tactics, some of the peer mitigation, and also conflict management. But this would bring together all that information in the school safety initiatives, and hopefully we can move forward with this bill. I don't believe this one has an amendment. Is that right, Tom? Did you have an amendment on this bill? No. Mr. Chairman, that is the bill. We hope to get much better information as a result of the tool, and there'll be other bills that'll come along that'll help us with some of the other school safety items. So I don't know if it'll here to speak in opposition, but that's
Thank you.
what the bill
Thank
does.
you, Senator Newman. No individuals speaking in favor, or do we have? Yes, please come forward.
Mr. Chairman, good morning. My name is Dave Cotter. I'm Policy Director with the Department of Criminal Justice Services. The Center for School and Campus Safety, which is what the bill tasks with developing the case management tools, housed with DCJS, and the administration supports the bill. There will be a financial impact on the bill. However, the governor has included that money for the development of the case management tool in his budget.
Okay, thank you very much. So the governor has it in the budget, but I think it would still have to, I believe it would still have to go to finance.
Let's just send it up there. If the chairman and the committee's okay, there's no harm in sending it up, make sure.
Okay, I think that might be best. Others speaking in favor? Yes, please, Stefan.
Mr. Chairman, Kathy Bircher, Virginia Education Association, and we support this bill. Our members actually asked for this year on the floor of our convention, so we are happy to see efforts to collect this data.
Very good, very good. Okay, just before we do that, any opposition to this bill? Certainly seems like something that's timely. Okay, we have a motion to report and re-refer to finance. And a second. All in favor, say aye. All opposed, say nay. Okay, the bill passes unanimously and will be referred. All right, so that's 1213. Which do you prefer to go forward with next?
Mr. Chairman, 1215, briefly.
Okay, proceed.
Mr. Chairman, as all of you know here, we currently have a number of drills that take place in schools. They include currently the fire drill, which was enacted in 1950, the tornado drill in 2001, the lockdown drill in 2013. The safety committee that looked at these items requested that we also set up one related to the school safety drill. There is a concern in the bill that I think some have brought to me that maybe the public school and secondary school principals should not develop the the training program, that makes sense. Normally, we don't have principals do that, so Tom, Mr. Chairman, has an amendment that fixes that problem, which I think gives us peace in the valley, if you'd consider that, sir.
Okay, Tom, could you read the amendment?
Thank you, Mr. Chairman. Senator Newman, on line 14, after each, strike public elementary and secondary school principal and insert local school board. Also on new line 17, insert that the Board of Education shall develop guidelines for the development and delivery of training required by this act.
Okay, everyone understand that? We have a motion to incorporate that amendment and a second. All in favor of doing that will vote aye.
Aye.
All right, do we need a recorded vote on that?
No.
All right, voice vote is fine. All right, do we have individuals who speak in favor of the bill?
Mr. Chair,
Yes.
can I ask a grammar question?
Grammar, yes,
Yes.
we're always interested in grammar
All right,
questions.
well, at line 15, it uses the word at least once annually training. Does that mean annual training? What annually is an adverb?
I think you are correct. If you don't mind, we can fix it here, or we can fix it but that's fine.
Okay, well.
So at least annual training, or
yeah, I think it just means
training
to
at
be
least
At least
annually?
once annual training.
At least
Yeah.
once annually.
Annual.
The problem is you have training coming out. The sentence needs to probably be flipped.
I just don't, well, what is it, what are you trying to do? What's the purpose?
We're going to have once a year, there will be training, okay? And the principals will be the one that will deliver the information to the
Right.
students and to the parents, and they will have the drill based on the training, yes.
At least once a year and annual are the same thing. So I would say either at least once a year or annual, either or.
That's fine. That's fine. Once a year is fine, Mr. Chairman,
right.
if you want to make that
I make that.
motion.
Okay, we have a motion to change to once a year. Is that fairly clear to everyone? All right, all in favor, say aye. Opposed, nay. That amendment is incorporated. Do we have individuals to speak in favor of that measure?
Mr. Chairman, Tom Smith, the Superintendent's Association. I just wanted to thank Senator Newman, and we've worked through this, and so we don't have any difficulty with it right now. Thank you.
Thank you. Yes, ma'am.
Yes, thank you, Mr. Chairman. Bette Neal with middle and high school principals. We thank the senator for bringing this bill forward and appreciate his looking at our suggestions. For
Thank you very
amendments.
much.
Thank you.
Mr. Chairman.
Yes.
Mr. Chairman, I'm sorry. Okay.
Senator, that was good.
I'd make a motion to report the bill as amended and re-refer to finance.
Okay, we have a motion to re-refer
Mr.
as
Chairman,
amendment.
Do you mind, that one I don't think has a fiscal impact that I know of, Tom, is that right? If you don't mind, just, unless there's a fiscal impact we're unaware of, maybe
Well,
we
Mr.
just.
Chairman, I'll reluctantly do that since he sends all my stuff to finance. I think,
There may be
I would
more.
withdraw that motion and then just make a motion to report this ultra-fine bill, and I hope you remember that.
Yes, sir.
Okay, so we have a motion to report as amended. All in favor will vote on the board yea. Those opposed, nay. All right, that bill passes unanimously. And then we have one more, Senate Bill 1220.
Yes, Mr. Chairman, Senate Bill 1220 also comes from the same group. I don't know that there's any opposition to the bill. This bill is one that speaks to the emergency management and emergency response plans, and adds to it that we will have the chief law enforcement officer, the chief fire, the fire chief, the chief of emergency medical services, or their designee will review over the plan. Most of you are familiar with this plan. It is one that this committee has been very much involved in developing. There is an amendment that has been requested, and Mr. Chairman, if you don't mind allowing the amendment to be read.
Yes, Tom, if you would read the amendment.
Thank you, Mr. Chairman. Senator Newman. On line 69, after agency, insert the Executive Director of the Regional Emergency Medical Services Council in which the locality is situated in. And then on line 78, insert the same language.
Okay, do we have a motion to adopt those amendments? Okay, we have motion and second. All in favor, say aye. Opposed, say nay. Okay, those amendments are adopted. Do we have individuals to speak in favor? And do we have individuals to speak in opposition? All right, it looks like there is a relative peace in the valley. We have a motion to report. Second, all in favor, we'll vote on the board aye. Opposed, nay. That bill is unanimously passed. Thank you very much, Mr. Chairman.
Very good. And with that, we have about 70 bills that were filed as of yesterday. Last year, as you may recall, we had 20 more bills than ever at 190. That's a big workload. I'm sorry to have you work today. We're going to start next time with your gracious concurrence at 8 o'clock, and we're going to work through as many of the bills as we possibly can before our final meeting. With that, Mr. Chairman, we will adjourn.
Thank you very much. The committee is adjourned. We do look forward to meeting early. We love that.
Tweet that.